Greetings, everyone. Thank you, Molly, and for everyone at the Institute for this opportunity to share about our new book, Minding the Brain, which is an application of developmental neuropsychoanalytic models to the intensive, comprehensive, multi-dimensional treatment of high-risk emerging adults. Contributors to the edited volume include notable clinical scholars such as Mark Soames, Alan Shore, Efrat Ganot, Jeffrey Arnett, several others, as well as authors from the professional staff at Yellowbrick. The book is really derived from the almost 20-year experience of working with these high-risk, very vulnerable, troubled young adults that have had multiple treatments from capable professionals within their home communities and often also at flagship referral treatment centers. So we've been challenged with the questions as to why have those prior treatments not been sufficient to help these young people firm up a coherent identity, be able to develop self-regulating capacities, and to kind of negotiate the process of separation that bridges the process of moving from adolescence to full mature adulthood. So we understand there to be 4 core components for how these young people need treatment that is different in its approach. The first is to recognize that all of these young people have occurrence and cumulative trauma such that they have profound limbic activation, which we can demonstrate on neuroimaging. And when individuals are functioning under a threat response mode within their brain, they're not in a position to learn, they're not in a position to relate, and they're not able to really heal. So the first part of our model is really directed towards how do we calm their brain and how do we help them to reset the limbic system such that they can begin to make use of the other resources and relationships within our treatment. The second issue which we recognized was that many of these young people have various kinds of learning disabilities, processing disorders, the multidimensional kinds of difficulties that go under the umbrella of ADHD. Many have TBI, which has not been previously diagnosed or treated effectively. And we're seeing increasingly people on the high level of the spectrum who have their own specific and distinctive kinds of cognitive rigidities, obsessionality, and challenges in processing new information. So we have a variety of interventions that attempt to address these cognitive neuroscience issues. A third element that I'm sure is of most interest to psychoanalysts is our approach to psychotherapy. So all of our patients have had many therapies with kind, supportive, well-intended professionals who practice within a mode of psychotherapy that is educational and really is directed towards new learning in a cognitive, left brain directed way. So this includes CBT, DBT, ACT, and a variety of other therapies of that kind. And so Um, this patient group obviously is not able to make use of these therapies when they are in distress, that their self-coherence, self-integrity, self-vitalization is not able to maintain itself in the face of acute distress. So we employ a variety of techniques, everything from mindfulness techniques, mentalization techniques, but also a heavy emphasis on identifying the co-created enactments that give us access to the unconscious right brain self-experience that has never really been encoded symbolically or verbally for the troubles that have been undermining the safety and functioning of these young people. And we use enactment as a red thread, not just for the individual work, but also within work in process groups as well as within the community as a whole. The community is the fourth component of our model that is very different from the kinds of programs that attempt to help these young people. The peer community serves many functions of rekindling the pilot light of vitalization, which includes, all the 7 affect states that Panksepp has helped us to understand better, along with Mark Soames, that it's within the peer relationships which form the heartbeat of the treatment process that these young people feel connected enough and safe enough to kind of come alive again and be themselves, and that provides the engine of the experience, as well as rekindling some fundamental affective emotional experiences such as hope, which is so crucial for these young people who've really been devastated and feel so demoralized about themselves, about relationships with others, about the adult world, and about their futures. So our book tries to delineate our thinking and describe our practice in all these various dimensions. So thank you for your attention, and I hope you'll be interested and take a look at the book, and of course I welcome any inquiries about it. Thanks so much. Bye-bye.